Nagaland registered a record single-day spike of COVID-19 cases today. A total of 194 cases takes state's overall tally of coronavirus beyond the 2,000 mark. Health and Family Welfare Minister affirms that there is no community transmission in the state as of now, as history of contacts have been established in all positive cases. And over 11.86 lakh people recover from coronavirus infection in the country. Recovery rate reaches 65.76%. Well, those were the headlines. Hello and welcome once again to this news broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from the state. In one of the highest single-day spike of COVID-19 cases from the state in a day, Nagaland today recorded 194 fresh cases of the coronavirus from across 3 districts of Nagaland. Today's fresh cases takes Nagaland's tally of COVID-19 cases beyond the 2,000 mark. Nagaland is in the 4th position in the northeast to have reported the maximum number of cases, behind Assam, Tripura and Manipur. The state has reported 130 cases as the highest in a single day on 1st of August before today's count of 194. Informing this in a tweet this afternoon, State's Health and Family Welfare Minister S. Pangipom said the 194 new cases were reported from the 845 samples tested. 136 were reported from Dimapur, 36 from Zinaboto and 22 from Kohima. The minister informed that necessary contact tracing have been activated and all primary contacts are under self-isolation. Dimapur, the worst hit by the COVID-19 pandemic, has seen spike in the number of cases of late. Health authorities have said most of the cases were from the armed forces, with few from quarantine centers and traced contacts. The district had been under lockdown for a week, which ended yesterday, and partial lockdown is in place from today. Although district administration and police have appealed for calm to prevail, there were reports of rush and chaos, especially in ATMs across the city. Today's addition of 136 cases in Dimapur takes the district's tally beyond the 1,000 mark. This is also the highest number of fresh cases reported in a single day, when the district reported 116 cases on 1st of August. With today's addition of the new cases, Dimapur's tally of total positive cases stand at 1,015, with 167 recovered, 2 deaths, 1 migrated, and active cases at 845. State capital Kohima has also seen a surge in the number of cases during the last 2 weeks. Since July 23rd, Kohima has so far reported 317 fresh cases of the virus, including today's fresh cases. The surge in the number of cases from the district has forced the District Task Force Kohima to impose 2 weeks lockdown in the district. The second phase of total lockdown within Kohima municipality, which began on 1st August, today saw commercial establishments downing shutters and public vehicles remained off roads. Public movement were also restricted. In many wards, few grocery shops were seen open in the morning to facilitate people to buy essential commodities. Meanwhile, the Northern Angami Youth Organization NAYO, while extending its support and solidarity with the Kohima District Task Force for the extended lockdown to fight against COVID-19, has also cautioned business establishments of taking undue advantage in hiking prices of essential goods. In a press release, NAYO warned against any such practices that affect the common people, adding that its volunteers would monitor the price lists set by the KMC. With today's addition of 22 more cases, Kohima has so far reported 534 cases of COVID-19 positive, with 138 recovered, 1 migrated, and active cases at 393. Out of the 393 active cases, 1 patient is mild and 1 is under ventilator support as per the severity of the cases. The rest of the active cases are asymptomatic. Zinobuto's tally has increased manifold with a total of 40 cases in just 2 days. Yesterday, the district reported 18 cases, out of which 17 were from the armed forces and 1 from among the quarantine center. According to CMO Zinobuto, Dr. Akaho, today's 36 fresh cases were also from the BSF personnel stationed at Sataka. The CMO informed that all the positive persons are being monitored at the COVID care center Sataka, and all of them are asymptomatic. Dr. Akaho informed that today's fresh cases were detected from the 50 samples sent to BSL-3 lab at NHAK Kohima. He said further tests will be conducted from the 14 samples that turned out negative. He said the situation is being monitored through close and active coordination between the district health authorities and BSF officials to prevent further spread of the infection among the armed personnel at Sataka, and therefore appeal to the public not to panic but extend support to the health authorities by following the health safety guidelines and protocols. The district has now reported 66 cases, out of which 5 have recovered, and active cases stand at 61. Except one active case, which is a civilian, the others 60 belong to the BSF personnel. According to the Nagaland government COVID War Room dashboard, the state's tally of total COVID-19 cases stand at 2,129, 648 recovered and 1,473 active cases. 4 persons have succumbed to the virus from the state. Nagaland Minister for Health and Family Welfare S. Pangipom has affirmed that there is no community transmission in the state as of now, and that this affirmation has been made as history of all contacts have been established in all the cases. In a statement, the health minister said there has been a spike in the number of positive cases in the recent days, particularly in Kohima and Dimapur. He said that majority of the confirmed cases are among armed forces personnel, and assured that vigorous contact tracing is being carried out in all the positive cases. The source of infection has been traced. He said out of the total reported mortalities, some are attributed to COVID-19 infection with multiple comorbidities. All the reported COVID-19 deaths as cases are presently under investigation by the COVID-19 death review committees at the district and state level, adding that based on the report, such cases will be confirmed as COVID-19 death or otherwise. On the BSL-2 lab in Dimapur, the minister informed that there was a temporary disruption of functioning from July 23 to July 28 due to acute shortages of consumables due to disruption of supply chain consequent to the lockdown at Guwahati and shortage of key products like pipettes all across the country. The lab is now functioning in full capacity, and the sample backlog for COVID testing is about 700 samples. The lab has tested a total of 4,700 tests since its inauguration on June 27, he informed. He informed that PCR reagents, kits and viral test media are supplied by ICMR, and the rest of the consumables are in the extraction kits, etc. are financed by the state government. All tests are conducted free and no patients are charged anything for these tests. The minister informed that the BSL-2 lab at Twensang is at its final stage of construction. There has been some delay which also linked to lockdown at Guwahati and compounded by quarantining of the technicians for 14 days. However, the lab is expected to be commissioned by the 3rd week of August, he said. The minister stated that the state now has a capacity to test over 1,200 samples per day. Additionally, rapid antigen tests are also now made available for COVID-19 testing. Private hospitals and laboratories have been permitted COVID-19 testing by TrueNat, as well as rapid antigen tests as per GOI guidelines. The Union Health and Family Welfare Ministry today said a total of 11,86,203 people have recovered from coronavirus infection in the country so far. In the past 24 hours, 40,574 recoveries were reported across the country. With this, the recovery rate reached 65.76%, and the case fatality rate has further declined to 2.11%. The Health Ministry said a total of 52,972 new cases of COVID-19 were reported in the country in one day, taking the total number of cases to 18,03,695. Presently, the total number of active cases in the country is 5,79,357. In a single day, 771 deaths were reported, taking the nationwide toll to 38,135. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Andhra Pradesh, Delhi, Karnataka, Uttar Pradesh and West Bengal. In the northeast, Assam has reported 42,904 cases of the pathogen. A total of 5,374 cases have been reported in Tripura, 2,831 in Manipur, Arunachal Pradesh 1,698, Meghalaya has reported 874 cases, Sikkim 658 and Mizoram has registered 482 infections so far. The overall number of global COVID-19 cases has increased to over 18.07 million, while the deaths have topped more than 6.89 lakh, according to the Johns Hopkins University. As of this morning, the total number of cases stood at 1,80,72,444, while the fatalities rose to 6,89,140. The US accounted for the world's highest number of infections and fatalities at 46,67,930 and 1,54,859 respectively. Brazil came in second place, followed by India, Russia and South Africa. Now the COVID-19 induced lockdown is starting to unearth a lot of hidden talents among the Nagas. Singing is one inborn talent that has been gifted to the Nagas, with many making it to the national and international arena. In this undated video, a young girl by the name Kenlum Yile from Jaluki town has brought out this cover of Gajendra Verma's Tera Ghata. This cover has been recorded at Sound King Studio, Jaluki. Watch and listen to this amazing voice and talent. We'll leave you with this song. Meanwhile, take care, and as you step out of your homes, don't forget to wear your mask. Always practice safe health hygiene and maintain social distancing wherever you are. Remember to protect yourself and at the same time protect your loved ones as well. Do subscribe to our channel, hit the like button and share our videos as well. Meanwhile, take care and thanks for watching.
कुछ सोच के बोला होगा तुमने, ये प्यार भी तोला होगा तुमने। अब ना है तो फिर ना सही दिलबर, इस दिल को ये समझा लिया हमने। इसमें तेरा गाता मेरा कुछ नहीं जाता, ज्यादा प्यार हो जाता तो दिल सह नहीं पाता। इसमें तेरा गाता मेरा कुछ नहीं जाता, ज्यादा प्यार हो जाता तो दिल सह नहीं पाता। अब और क्या कहना होगा